Thank you so much, Dr. Cartwright. I'm so happy to be here today. For years, traditional medical school curricula has lacked meaningful and substantial training in nutrition integration in the healthcare of our patients. Can you imagine? One of the leading risk factors for worsening disease, morbidity, and even mortality is a poor diet. Yet it wasn't being built into our lexicon. This all came to a head when I was in my pediatrics residency training program. I remember sitting in front of my 4-month-old patient and their family. I was asked a very important question. They said, Dr. Kofi, we want to make sure our baby grows up healthy. Is it time for solid foods yet? When do we start? How do we start? What do we do? I looked around the room for support, for backup, and I realized I was in this alone. I ran out to talk to my supervising docs, and they told me, kids are resilient. It's going to be okay. I said to myself, that could not be the answer. And I knew I would have to find resources to train myself. I began to realize that my gap in knowledge around childhood nutrition and infant feeding, especially during those first 1,000 days of life, was consistent with most training programs around the country, and it was very worrisome. You see, those first 1,000 days of life, from conception to the age of 2, are critical because the brain is growing at its most rapid rate, and it is incredibly vulnerable when it lacks the essential nutrients. During that time, if the baby's brain doesn't receive the necessary nutrients, we are not giving that child a fair chance to thrive, and we may be hindering their development. We cannot say to that child, it's fine, you're resilient, you'll catch up later. We cannot treat those initial years as forgotten years. We have to be strategic and intentional. I began to realize that this was a systemic issue. We needed to do better, and I promised myself that I wanted to be a part of a paradigm shift on how we address these topics. I truly believe that food is medicine. It is a critical part of good healthcare, and it deserves a chance throughout the life course of families. The reality is that in order to have a lasting and persuasive impact, there is no way that healthcare can do this by itself. We need a multidisciplinary, dynamic, systemic structural approach. And that's why I became involved with PHA's Veggies Early and Often campaign. As a coalition member, I am part of a cross sector nutrition education collaborative, bringing together food manufacturers, researchers, clinicians, and early childhood educators to raise awareness about how children develop taste preferences. We want to ensure that all young eaters, no matter their background, have a fair chance to become healthy and adventurous eaters from the very start. We aspire to raise a generation of veggie lovers. Our goal is to go upstream and transform policy, improve education, and address structural barriers so we can all collectively recognize that these early years must never be forgotten. Please allow me to highlight just a few of the amazing accomplishments of this initiative. In January of 2021, PHA launched the Veggies Early and Often campaign alongside a dozen founding partners in conjunction with the release of a white paper titled, Yes, Kids Can Learn to Love Veggies. This amazing white paper highlights a simple and yet profound fact. Exposure to veggies early and often is key to raising adventurous, healthy eaters. Food industry leaders, early childhood educators, medical professionals, and yes, even our parents and caregivers can read this paper, use our graphics, and gain great insights into cutting edge research and practical advice in early childhood feeding. The second major accomplishment of PHA's Veggies Early and Often initiative has been its partnerships to raise the bar on early childhood food offerings across the country. The marketplace has been heavily saturated with fruit-based, fruit-mixed, or even super sweetened products that takes advantage of our innate human desire for sweet, but does very little to expand our palate to the variety and diversity of other flavors that are needed to establish healthy habits and counteract picky eating. Fact, veggies are critical to a healthy life. 90% of toddlers don't eat the recommended amount of vegetables per day. Guess what? 90% of adults don't eat the recommended amount of vegetables per day. We eventually want our babies to grow to consume what everyone else in the house is consuming. So you can imagine how this veggieless cycle just continues on and on and on. So, what is a way that we can change behaviors and make the healthy choice the easy choice? Look for the icon. That's right, we developed PHA's first ever Veggies Early and Often icon for products and menu items. This special icon is able to be used on products that contain more than half vegetables and no additives. We are successfully working with 10 companies around the country that have adopted this icon, saturating the marketplace with over 150 products that meet PHA's highest veggies early and often icon requirements. Finally, another accomplishment I am particularly proud of is how we've hosted dozens of conversations with physicians and trainees, early childhood education professionals, and food industry leaders all around the country to talk about the important findings and implications of this research. And you know what? We're only just getting started. Ultimately, we want to ensure that in doing this great work, we are not worsening disparities. We are not worsening inequities. So we have made a decision to recognize the role of food and nutrition security in our messaging and in all of our training. We need affordable baby, toddler food products with exciting, enjoyable flavors. And we need product lines with a wide variety of vegetables. We need options that don't hide but enhance the flavor of vegetables in ways that are culturally diverse and appealing. We need to help parents and caregivers give their babies the best possible start to life. We must work together to educate consumers and transform the food landscape. If your brand or organization believes and is committed to the same things as PHA, we invite you to join Veggies Early and Often. We aim to add new commitments from baby and toddler food manufacturers, as well as early childhood education providers, to increase affordable and veggie forward offerings as soon as possible. Over the coming months, our team is finalizing some essential patient education materials that will be sure to enhance the clinician's ability to engage families on these important topics in early childhood feeding. And we plan on releasing these tools at one of the largest pediatric professional conferences in the country in October of 2022. I think back to my 4-month-old patient, and I wish I could have done it differently. But yet, I see a future where my colleagues will have a more uniform, powerful, and collective message that recognizes the importance of veggies early and often and connects families to meaningful federal and local resources to be able to support these efforts. It is our collective responsibility to give our next generation a chance to thrive. We must not point fingers, but recognize the importance of collaborative, multidisciplinary campaigns such as Veggies Early and Often to centralize the family, promote health equity, and ensure that no child is forgotten. Thank you for your time.